audible?
Yes, sir.
Yes, sir, it is audible. How are you all?
Fantastic, sir. How about you, sir?
Fine.
Good afternoon, sir.
Good afternoon.
Good afternoon, sir.
Good afternoon, all of you. So we have another 8 classes. It's online classes. Okay. And we will complete the rest of the syllabus. I think nearly 50% syllabus we need to complete within these 8 classes.
Sarada.
Please, all of you, yourself, please. I think 11 units already completed in the previous 8 classes. We have some offline classes, no? Now, rest of the classes, rest of the units. That is from 12 to 23rd units. We will discuss. Today, 12th unit we are going to start today. Okay. Okay, the first 12th unit in the first part is the eating disorders and sleeping disorders. These are the 2 disorders we will discuss in this 12th unit. Okay. Yes. See, in our normal life, eating and sleep pattern, these are the most important need in our human life, because we have some physiological needs and psychological needs. As Abraham Maslow's hierarchy of needs, our basic needs like eating and sleeping, these are the most basic needs of any human being. If these both needs are not fulfilled, there may be some issues of emotional disturbances, thereby like other psychological issues we need to face. We will face if we are not, if our needs are not fulfilled. These both needs like eating and sleeping needs are not fulfilled in any human life. What happens? There is a normal pattern of daily activities. It somewhere it may be deteriorated. So that is the reason these both habits like sleeping habits and eating habits, or you can say these both needs are needed in our human life. Okay, so here if we fulfill, if our needs are fulfilled in our life, everything will be the normal state. If these needs are not fulfilled, automatically the adverse impact on our daily life, as well as continuously it happens. 1 or 2 days, if you are not in a position to sleep but not taking proper food, that impact will be only on the particular day or another day. But continuously, the same thing is happening. So slowly, these both not fulfillment of these both needs adversely impact our emotions as well as some psychological disturbances we will face because of not fulfillment of these both needs. So first we will discuss the eating disorders first. Some eating disorders we will discuss. Later on we will discuss about the sleeping disorders. Okay. Yeah. In our eating disorders, the main important eating disorders are one important disorder is that Anorexia Nervosa. That is one eating disorder. Second is the hello, am I audible? All of you listening?
Yes, sir.
Yes, sir.
Yes, sir. Yes, sir.
Yes. Anorexia nervosa is one eating disorder. Second is the Bulimia Nervosa. Third is the binge eating. These three are the disorders related to the eating. In Anorexia nervosa, that they in this particular disorder, or you can say eating disorders, the main important thing is that not eating in a proper way. Means there are symptoms of this anorexia nervosa. Means not eating for a particular reason. Anorexia nervosa disorder is that generally this disorder we will find it in the age of 12 to 18 years, like from puberty to late adolescent stages. Okay, so this anorexia, this is the term derived from the Greek word. That means that literary meaning of this Greek word anorexia means without or no desire, without the desire of eating, means without a desire for food. They don't have desire of getting food. So means here in this particular disorder of eating, so the children, or you can say adolescent people between the age of 12 to 18 years, they will have some preoccupied mentality by eating of food, proper food. That means they will think that by taking the food, they'll have some sort of issues like their weight may be increased, and then their body image may be some sort of image they'll lose. Some sort of preoccupational with food. In anorexia nervosa, the adolescent people between the age of 12 to 18 years, they think by taking food, their weight will be increased. That is number one. Number two, preoccupational with food means there may be some heavy calories in some sort of food. If they take heavy calorie food, their body shape may be some sort of obesity with this type of food. That is their wrong notions, or you can say preoccupation with food, or you can say some sort of obsessive thoughts with the food, or some type of calories or fat in the food. They have the obsessive thoughts by taking out this food. Means, so generally these that is expressions, they won't express, but the underlining of these not taking this food, their thoughts, the way they think is by taking this food, by taking the normal food, they'll have some problem with their body shape. They'll have some problem with the shape of the body. These are the preoccupational thoughts, or you can say obsessive thoughts of these children, or you can say adolescent people. So that is the reason they don't take proper food. So without taking food, they will have some type of activities. Okay, and generally what they do, hiding the food. For example, refusing to eat by telling that, so I am not, I don't have any need of food. I'm not hungry, and some sort of rigidness, eating with in some sort of rigidness. They don't want to eat proper food, and they'll tell by taking the food, I'll have some problem with my body. Okay, habituations. Their habits will be some sort of different type of habits. So this obsessive thoughts. Obsessive thoughts means obsessions with calories, obsession with some sort of nutritional issues, obsession with some sort of fat things. Okay, so this, because of these reasons, because of these obsessive thoughts, the intake of the food is very less. That means without food. That is the reason we are talking about this anorexia, means without, no desire of getting food. Okay, this is one important disorder that is known as the eating disorder, that is anorexia nervosa. Okay, and due to this not taking proper food, so drastic weight loss with no medical reasons. If you observe this type of symptoms, okay, they won't take proper food. Because of not taking food, their weight, they lose the weight. Okay, without any reason, without any reason means without any medical reasons. So, and one type of other symptom is that feeling of fat. So they will, though they are having underweight, they'll weight is very less. Though their weight is very less, but they won't take proper food. Okay, and they'll have some sort of fixation on body image. Okay, so their weight and their body shape. So they'll have some sort of feeling with their fixation. Okay, fixation on body image. Okay, they will fix to the particular image. Not by taking food, they will have some sort of issues related to their body image, related to their weight. Okay, so that is the reason they deny, they'll refuse to take proper food. Okay, this is one sort of disorder, or you can say abnormality. Why we take this an abnormal? Why we talk about it? It's a disorder. Abnormal means not a normal way. Generally, if you take proper food, the normal timings, normal quantity of food, that is normal as per our cultural issues, as per our socio-economical status. Okay, so if they are not in a position to follow our norms, abnormal. That is the reason we call it as a disorder. Disorder related to the eating habits. So that is one disorder that is known as the anorexia nervosa. Okay, then generally this type of years, generally in some years back, this type of anorexia nervosa eating disorder, generally we found this type of we observe this type of disorders in the Western society, Western culture. But nowadays, even in Indian culture also, this type of cases now we are finding in our Indian cultural structure also. So this is one disorder that is known as the anorexia nervosa disorder. As
Sir, can I have a doubt here? Can I ask for a doubt?
Yeah.
Is this disorder mostly found only in the urban setup, or is the rural setups also? Does that make any difference if it is urban or rural? Two parts of my question.
Generally, this type of urban or rural, urban or suburban or rural. So generally, this type of disorder recently we are finding in our Indian structure. Previously, there is no much difference between the urban and rural. Generally, working people, for example, if the working people are working laborers, they will have proper food because they are hard working people. Their work is hard work. That is the reason. Generally, these type of issues we won't find in the rural setups. Okay. Hello.
Yes, sir. Thank you.
Yeah. Yeah. Second one is the bulimia nervosa. Bulimia nervosa. This is the second eating disorder. So in bulimia nervosa, it also derived from the one important Greek word, that is bulimia means this ox or cow. Okay, or you can say it means heavy intake of food, or you can say heavy consuming of food. So quite opposite of the anorexia nervosa. This is bulimia nervosa. So here in this case, in this type of disorder, the food intake is high. Intake of food is high in this second category of disorder or second type of eating disorder. So here the symptoms of this bulimia nervosa, lack of control on food intake, okay, or you can say overeating of food, okay, that's number one. So eating unusually, or you can say abnormality in case of eating, okay. So whatever they take food, immediately after some time, after some hours, again they wanted to get the food, okay. And this craving of food, that means they always want to take food, they always searching for food, okay. Then there is a if they take food also, immediately after some time they want to take some food, they'll search for food, okay. Generally this type of food habits, they'll take junk food also, okay. So here in this overeating of food, and one more important thing is that, so they take food but without any proper exercise, and they don't have any other sort of exercise or any other type of body activity, or you can say regular activities. So here taking heavy food, or you can say consuming over food without proper exercise, without even proper work also, okay. So they don't have control over eating. Second is whatever they see in the surroundings, definitely they'll go to the take, then they'll go and take the food, okay. Then eating unusually, okay, heavy amount, or you can say large amount of food without any reason, okay. And the third one is that if they won't get the food, they'll have some sort of disturbance in their normal life, okay. So this is one symptom of this bulimia nervosa. Then if you observe the symptoms of this persons, or you can say children, so even though they'll take heavy food, but their weight is somehow it is normal, okay. So though they don't have any normal weight, they don't have any underweight. Men and women with bulimia are usually normal weight or slightly overweight, okay. Though they take heavy quantity of food, their weight is not abnormal, normal weight, at least minimum of slightly overweight, okay. So being underweight, they'll take that, they will think that, so by taking heavy food, nothing will be happen. That is the reason. Keep on consuming heavy quantity of food or large quantity of, or you can say large amount of food. That is the another important characteristic of bulimia nervosa. Okay. If you observe this type of children as well as the adolescent people, so if you observe this individual's teeth, discolored teeth means some sort of color. If you observe the teeth of this particular issue, like yellow or one type of some sort of light yellow color teeth, if you observe this, because continuously they'll get the continuously they'll take food. That is the reason this type of symptoms we observe in these individuals. Okay, and one more important symptom is the fluctuating of their weight. Okay, sometimes their weight is high, overweight. Sometimes their weight is some underweight. Normal weight you observe in some cases means fluctuation of their weight. Okay, due to alternative episodes of food. Okay, that is the reason some sort of fluctuations in their weight. This is the second important disorder of eating disorder. Third one is the binge eating. In binge eating, this disorder is characterized by compulsive overeating. So though they don't have any hunger, they don't have any need, but they consume large amount of food. With the food, they feel some sort of disturbance in their normal life. They feel their hello. Though they know this type of overeating creates some sort of embarrassment situations, but they can't control on this overeating, that is binge eating, you can say. They have some sort of symptoms related to their behavior. So they want to stop this type of overeating, but they won't be in a position to control this overeating. Okay, inability to stop eating, or you can say control whatever they are doing. Then rapidly eating large amount of foods. That is the second symptom of their behavior. They will take the food even though they are full of. They'll take large amount of food. Even after taking the large amount of food, again they wanted to eat, but they don't want to control it. They are not in a position to control. They are unable to control this type of habit. And sometimes they eating normally around others, but they'll go on some other phase. Again, they'll take food. Okay, eating continuously throughout the day with no plan of their it is eating habits, or you can say meaningful eating habits. Okay, these are all the symptoms of binge eating. Because of this binge eating, not only their behavior, their emotions, like emotional symptoms also, they will have some sort of emotional disturbances. So because they wanted to stop this type of large quantity of eating, but they are not in a position to control over it. That is the reason some sort of stress and tension they wanted to, because their feeling is that their overeating, the habit of overeating, they wanted to stop, but they want to stop, but they are unable to stop it. That is the reason some sort of emotional disturbances, then face some sort of emotional imbalances, feeling stressful condition or tension. So because of their stressful condition, because of the tension, they think that is the reason of their stress. They want to relieve they want to get food to relieve from the stressful condition, or you can say tension. That is their feeling. Embarrassment over how much you are eating. So they'll have some sort of embarrassment because they want to stop this type of overeating, but they are unable to control over it. Okay, then never feeling of satisfied, no matter how much they eat. They don't satisfy, they don't have satisfaction. Whatever the amount they eat, but they won't satisfy. They always there will be dissatisfaction. You can observe the dissatisfaction in this individuals who are having this type of eating disorder, binge eating, and feeling of guilty, disgusted, and depressed because of their overeating. And so they don't want to, they want to control it, but they are not in a position to control their eating habits. That is the reason some sort of emotional disturbances if we observe in this persons who are having this type of binge eating. Okay, then what are the ways? We discussed about the 3 types of disorders. Okay, in this what are the main reasons? See, And as I mentioned in our previous class, I think.
What is the main difference of bulimia nervosa and binge eating, sir?
Okay, bulimia nervosa, they don't want to stop it. But here in this binge eating, they wanted to control over it. Okay, they know that this overeating is not is normal, but they want to control, but their habit they can't control. That is number one. Number two is that another important symptom is that here in this particular bulimia nervosa, their weight is maybe normal or some sort of slight difference of their weight. But here in this case of binge eating, their weight also it is overweight. That is another important symptom of this. Okay. So anorexia nervosa and bulimia nervosa, then binge eating. These are the three eating disorders. Then, as I mentioned, any psychological disorders, first of all, in examination point of view, first of all, we need to explain what is that disorder, number one, and symptoms of disorder, characteristics of disorder, we can say. Then reasons of disorder. This is the way you need to explain, you need to write in your examinations also, any sort of disorders. As I mentioned, eating disorders, there are three types of eating disorders. These are the symptoms of eating. Next one is that what are the reasons, what is the factors of this disorder. Okay, so one is the genetic reasons. You can say one important thing is one important reason, or you can say cause of this particular disorder, eating disorder, is the genetic reason. As you know, almost any psychological disorder, it is very easy to answer. Any psychological disorder, if you want to give answers, this type of cause you can mention in any sort of disorder, genetic reasons. That is number one. Or you can say biological abnormalities, means medical reasons. Biological abnormalities means some sort of genetic reasons, or you can say chromosomal deficiencies also, or hormonal disturbances, hormonal imbalance also, reasons of any sort of psychological disorders. Okay, number one, here the same thing here, genetic and biological disorders, biological abnormalities. Number one is the psychological factor, psychological reasons. As I mentioned, in order to relieve their stress, especially in the binge eating, see, they'll relieve their stress. They feel that it's not the actual solution of getting some sort of relief from their stress, but they think that, they feel that. Okay, that is their preoccupied mentality, that is their obsessive thoughts. Okay, by taking this type of heavy intake of food or food, they think that their stress will be okay. So this is known as the psychological factors. Number one is the genetic factors, second is the biological factors, third is the psychological factors, or you can psychological reasons. Another one is the socio-cultural factors. Socio-cultural factors. Socio-cultural factor means some society, some culture, as I mentioned in our initial class. So in previously, in the old and ancient days, these type of eating disorders we find only in the Western society.
Excuse me, sir.
Yeah.
So can you please once again repeat the psychological factors leading to these eating disorders?
Yeah, psychological factors means, as I mentioned, especially in the binge eating, if they face any type of stressful conditions, in some cases, not all the individuals, some individuals, if they wanted to relieve from the stress. Okay, for example, some professionals or some individuals, they think by taking tea or coffee for every 1 hour or 2 hours, they think, this is only example I am giving, they think that some sort of relief by taking coffee or some type of food. Okay, even some people, they'll consume some sort of this packed food also. Okay, if you observe, I think, if you observe some sweets, they'll consume. Some people, some type of this food they'll take. Okay.
Yes, sir.
Okay, I think you might be observed in some cases, not all. We can't generalize these things, especially in some setups where the stress will be more and some sort of stressful situation, stressful environment. For they think that to relieve from their stressful situation, stressful conditions, better to take some food. They'll consume some sort of food. Okay, that is one type of psychological reasons. Got it?
Okay, sir. Thank you, sir.
Yeah. Socio-cultural factors. First one is the genetic factor. Second is the biological factor. Third is the psychological factor. Fourth is the socio-cultural factor. Socio-cultural factors means because of their cultural aspects. Okay, they'll consume food. Okay, that is social. As I mentioned, the Western society, ancient days Western society, they eat some sort of stuff. Okay, so that is socio-cultural factors. Then another one is the media, also one factor. Media, for example, in some social media or any other mainstream mainline media, they'll to promote their products, they will introduce some sort of foods. Okay, so this type of media also one of the reasons of this eating disorders. Okay, as I mentioned, life changes, stressful life change also. Then some sort of professional activities, or you can say professional activities that focus on one's physical appearance. For example, they wanted to shaping their face or body. So that is one of the reasons of getting heavy food, or you can say eating disorders. Okay, so in any disorder, after completion of the reasons, then what to do? Like role of the psychology. This is the way you need to answer any question. One is defining or explaining that particular disorder. Second is the symptoms of the disorder, or you can say characteristics of disorder. Next one is the reasons or factors of the particular causes of the particular disorders. Then finally, role of the psychologist. So what is the role of the psychologist in the particular issue like eating disorders? First of all, we have to listen their habits without any judgment. We can't say you are taking heavy food. First of all, we need to listen from the individual why they are taking this heavy food. Okay, as I mentioned, we need to check what are the reasons. As a psychologist, we need to listen from the client, from the individuals, so that you will identify the main reason of taking heavy food, or you can easily find out the cause of this specific eating disorder. Okay, if there's any obsessive thought of a heavy taking of heavy food, so these obsessions we need to resolve. We need to address these obsessive thought. Some type of stressful conditions in their workplace, some sort of stressful conditions in their environment. If we find, as a psychologist, if we find this is the reason of their abnormal eating, or you can say eating disorders, better to address those environmental issues, or you can say stressful conditions. Be better to give proper counseling to relieve their stressful condition, or you can say any psychological issues. You be better to explain this is not the actual solution, but what are the other solutions to relieve from their stressful condition. Those things we better to explain in our counseling psychology, or you can say psychological counseling. So another important thing is some sort of therapies you can give here to improve their thought process. If there is any
Excuse me, sir.
yeah.
Sir, how can we give those trainings, therapies, sir, like family therapy, group therapy? Do we train for that in this course?
Yeah, family therapy, group therapy, or individual therapy. What are the therapies? There are the various types of therapies. Okay, by
Yes.
therapies are different type of therapies. So that the way you are giving the therapy, these are, you can say, counseling techniques. So you can give the family therapy, individual therapy, or group therapy. Okay, what are the therapy means? So first of all,
Yes.
you need to find out the reasons. No?
Sir, how many therapies is there, sir?
Therapy C is a behavioral therapy, actually behavioral therapy, or you can say CBT, cognitive behavior therapy. Therapy is a broad term. Techniques are different. We have cognitive restructuring therapy, cognitive behavior therapy, systematic desensitization therapy, de-addiction system. Okay. Hello, ERP, exposure response prevention technique, systematic desensitization technique. So how many therapies? Therapies are so many. Okay, depending on the case, depending on the disorder, depending on the age, depending on the environment. Got it? Hello.
Yes, sir. Thank you. But do we gain hands-on skill in this training, sir? In this course,
In this course.
do we gain hands-on skills?
Mm-hmm.
So, do we train for that? How to give, how to impart trainings to these kind of disorders?
You are talking about examination, our textbook.
Yes, sir. Yes, sir. Practically, I'm talking about practical aspect.
In general question you are talking, not
Yes.
our textbook or our subject, no?
Okay. Yes, sir.
Yeah, see, as per our examination point of view, wherever it is possible, for example, in this particular case, disorder or dementia, so behavioral, there are some behavioral symptoms in this particular disorder. They mentioned here emotional symptoms and behavioral symptoms. That means some behavioral problems are there in this binge eating, or some type of symptoms related to their emotions. Okay, for example, find, as I mentioned earlier, if you find any behavioral symptoms in the particular cases in the individual of eating disorders, so better to give behavioral therapy.
Okay.
That is number one. If you want to change their cognition also, cognitive restriction technique, or you can say cognitive behavior therapy.
Okay, sir.
Fine.
Yes, sir. Thank you.
Symptoms related to the emotions. That means their emotions are not logic, irrational emotions. There, another technique that is known as the RET, rational emotive therapy.
Okay, sir. Sir, how can we learn those techniques, sir?
That's what I'm telling. Here in our PG level, whenever the technique is needed in the particular topic or unit, definitely I'll explain.
Okay, sir. Okay, sir. That's right.
Yeah.
Sir, I have one more doubt,
Thank you,
like whether we get this practical experience of training these things, sir?
Yeah, why not? Why not? Why not?
Like during our practicals, we can do this by like in person or what?
In practicals, we give some sort of practices, some sort of, we explain in our practical sessions, we explain some sort of tools, some sort of experiments. Like, for example, I'll give you one example. For example, if you find out the interest of the child or interest of the person, example of completion of their 10th class or 12th class, if you have any conflict,
Srihari, can you go on mute, please?
yeah, in that particular interest, if you want to find out the interest of the child or person, there one test, that is CIS, Comprehensive Interest Schedule. This comprehensive interest schedule is there in your practical manual. Some personality tests. Okay, this is also one of the important practicals, or you can say experiment we will practice in our practical sessions. And DBDA, David's battery of differential ability. Okay, each and every practical related to some sort of emotion, some sort of interest, some sort of personality, some sort of intelligence. That is the reason in your PG manual, PG curriculum, you can say it's fifth paper, first year fifth paper, as well as second year fifth paper, course 5. There are some experiments. Some experiments are related to the emotions, or you can say EIS, emotional intelligence scale. That is one experiment that is there in your schedule. Okay, EIS related to interest. CIS is related to the interest. Okay, and EIS is related to emotion. IQ test, 16 PF related to the personality. Some tests are related to the personality. Some tests in your syllabus related to the interest. Some tests are related to the intelligence. Some tests are related to the emotions. Some tests are related to the ability. For example, DBDA is the one test in your first year as well as the second year. DBDA means differential abilities. So by knowing their differential abilities, means numerical ability, clerical ability, okay, spatial ability, okay, you can suggest the child what is the subject they wanted to option after 10th class, depending on their abilities, depending on the interest, depending on the emotions. Got it?
Right, sir. But my doubt is that, sir, like a person with psychological disorder is called to the college and we are supposed to do this practical thing on him, or what, sir? Otherwise, we are doing it theoretically in practicals.
That's what I'm telling. Being a PG psychology aspirant students, we have some theoretical aspects in our 4 papers plus 4 papers, total 8 papers in the first and second year. And 5th paper and last 10th paper, 2 papers in your first year and second year related to the practical exposure.
Right, sir.
Okay.
Thank you.
Yeah. So, we are talking about the psychological counseling related to this eating disorders. No, yeah. So one is we need to find out the reason of the particular disorder. I can say eating disorders. So wherever the particular therapy, or you can say technique is needed, we better to give the counseling related to the particular therapy or technique. As I mentioned, for example, if there's any behavioral symptoms if you find in this disorder, better to give the behavioral therapy. If you want to change their cognition also, that means preoccupied mentality. Preoccupied mentality means though they have proper weight, they wanted to reduce their weight. That is their preoccupied mentality, or you can say obsessive thoughts. Obsessive thoughts on particular eating of some calories, or you can say some fats, like, okay. If you find this type of obsessive thoughts, we need to use some technique that is known as the ERP. If it is obsessive thought, ERP, exposure response prevention technique. Or if there is any problem related to their behavioral symptoms, so better to give the behavioral therapy. If you want to change their cognition, means thought process, means cognitive restructuring technique. Got it? And if there is any problem with their emotions, so rational emotive technique. So these are all the very deeper aspects of this counseling. Only you can give the counseling related to their behavior. Whatever the odd behavior you observe, better to change their behavior enough in this particular level. Okay. Any doubts, Shantisri? Okay, fine. Yeah. And so these are the various psychological techniques or you can say therapies we follow in this eating disorders counseling. And if, for example, there is any issue, if we find with their nutritional thoughts, nutritional aspects, better to involve the specialist related to the nutritional, or you can say nutritional counseling also. We can use these people. Okay. Then next we will move to the next topic, that is sleeping disorders. Sleep disorders, you can say. So as I mentioned, we have some human needs. Human needs, as I think you already learned about Abraham Maslow's human needs. Okay, in Abraham Maslow's hierarchy of needs, basic needs, this sleeping and food, taking of food, both are comes under the basic needs, or you can say first order needs, or you can say physiological needs. In this physiological, or you can say basic needs, some needs related to the sleeping. Proper sleep is needed. It is for normal functioning of our any activities, normal functioning of human being. Sleep is so essential. Okay, so the duration of sleep is depending on the age. Okay, for example, if the normal individual, they need some type of 7 to 8 hours or 9 hours sleep, whereas for the infants or the babies, up to 12 to 16 hours of sleep is needed. Okay, average sleep is 8 hours sleep is needed to any other individuals. So here we have some other types of sleep disorders also. One is the insomnia. One disorder related to the sleep is insomnia. Okay, insomnia is one sleeping disorder, means inability to get the proper sleep, inability to sleep is known as the insomnia. Insomnia is the inability to get proper sleep. What are the, I think, as I mentioned, what is the required sleep of 8 hours? Okay, so they won't get proper sleep, inability to get proper, or you can say need to sleep. Okay, so here the one important reason of, so first of all we will discuss about the types of sleeping. One is the sleep disorder, one is the insomnia, second one is the hypersomnia. Hypersomnia means oversleep in the, even in the, they'll sleep at least excess of the normal sleep, right? Typically, as I mentioned, 8 to 9 or 10 hours are needed, but they sleep pattern is above this particular period, or you can say above the actual sleep of 10 to 12 hours. Okay, that is hypersomnia. One is insomnia. Insomnia means less sleep, or you can say inability to get the sleep, whereas hypersomnia means excessive sleepiness during the night as well as the day also. Okay, so for not only for 1 or 2 hours, for 1 or 2 days, months together, okay, they'll have this type of hypersomnia. As I mentioned, insomnia also, if it is only for 1 or 2 days, you can't it's a disorder. If it is months together, weeks together, this type of sleeplessness, or you can say inability to get sleep, is called the insomnia. Same way, even the hypersomnia. So if it is 1 or 2 days, means nothing will be happen. It's not abnormal. It won't come under the abnormal behavior. Whereas if it is continuously for this type of excessive sleep pattern, continuously for months together or for longer period of time, you can say it is a hypersomnia. And third one is the narcolepsy. So here in this one, the third one. So in narcolepsy, here this type of sleep is while they have their own work, suddenly they'll get sleep. While they are in a walking, while they are in the driving, this type of one type of exceptional cases. Oversleep is different, that is hypersomnia. Whereas in the third type of sleep, they'll have sudden sleep during their even daytime also. They'll have some sort of sleep even the daytime, even they are during their work place also. They are doing some work. They are maybe in the diving. They may be in the walking on the roads, but they will have sudden type of sleeping for a moment. Okay, this is very dangerous type of disorder, sleeping disorder. Okay, then fourth one is breathing related sleep disorder, or you can say sleep apnea. Here in this particular this repeated disruptions or disturbance while they are in the sleep. While they are in the sleep, suddenly they'll wake up because of their respiratory systems, respiratory problems. People with this problem experience repeated disruptions to sleep due to the respiratory problems. The frequent disturbances, frequent disruptions. So this type of disruption, this type of disturbances leads to some sort of dangerous conditions. Okay, this is the fourth disorder, is known as the breathing related sleep disorder. Okay, and fifth one is the disorder. Here, circadian rhythm sleep disorder. Here, so the actual cycle, most bodily functions follow a cycle or an internal rhythm called a circadian rhythm. But here in this case of disorder, they'll disturb the actual cycle. Okay, actually the sleep cycle is that. So the actual our sleep pattern is some type of evening 10 to morning, say 8, 7 o'clock or 6 o'clock. But in this system, their sleep pattern is entirely different time. Okay, they won't sleep in the night time. Okay, so their sleep pattern is not normal schedules. So they disturb. They'll sleep zones, frequent and time zones. Their timings, their sleep patterns. So normal sleep patterns they won't follow. Okay, this is one other type of disorder. That is fifth one. Then another one is the nightmare disorder. Nightmare disorder means, or you can say parasomnias. Nightmare disorder means here in this disorder, recurrent awakening, and for example, they will sleep for half an hour immediately after getting some disturbances. Immediately they'll wake up because of some sort of frightening situations, some sort of dreams, some sort of nightmares. Okay, suddenly they'll wake up. So in some cases, due to their fears, due to their emotional issues, sudden awakening, some sort of disturbance of their sleep. Okay, and another one is sleep terror disorder. Sleep terror disorder means suddenly they'll have some sort of anxious condition. Person will sleep, suddenly they'll sit up and they'll appearing frightened. Okay, some sort of shivering positions, sweating with rapid heartbeats and respirational problems. Okay, this is another disorder related to the sleep. In some cases, sleepwalking disorders. Sleepwalking disorders means they'll sleep, they automatically they'll walk, and they'll again go and sleep, but they don't know. In some cases, this type of sleep disorders find. Okay, this is known as the sleepwalking disorders. In sleep, they'll be in a deeper sleep, but suddenly they'll wake up, they'll arise from the bed, and they walk about some time. Again, they'll go and remain sleep. Okay, if you ask them, this type of behavior happened in your night time, but they won't aware of those things. Okay, this is one type of disorder that is known as the sleepwalking disorder. Then, what are the reasons of this disorder?
Sir, one doubt, sir.
Yes.
Is insomnia is related with the anxiety disorders?
Yeah, that's what. Yeah, that's the reason I'm going to next one. So
Okay.
Here, next what topic is that? So reasons means psychological disorder. You are talking about the anxiety, depression, some sort of. See, yes, we mentioned. Yes, one important thing I want to explain here. See, when we are wake up, our mental process will be continuing even after sleep also, even our sleep time also. The body will take rest, but the mental process will be continuous. It will functioning. Got it? If there is any anxiety, if there is any depressive conditions in our daytime, in some cases, they will continue even in the nighttime also. Got it? That is the reason this type of some sleep disorders. One important, as we mentioned, yes, anxiety, anxious conditions, you can say some sort of depression, some sort of emotional issues leads this type of sleeping disorders. Okay, so that is number one reason. Number two, that these reasons are known as the internal reasons. In your question, this type of reasons are known as the internal reasons. Internal reason within the person. Reasons related to the internal issues of the person. That means you can say it is the emotional, internal reasons. It means anxiety, depression, and some sort of emotional disturbances, or some sort of fearful condition, some sort of emotional imbalance conditions. That is known as the internal conditions. These are all the reasons of the sleep disorder. Number one. Number two, some sort of external reasons, external causes, or you can say external reasons. External reasons means environmental reasons. Environmental reasons mean some sort of disturbances in their surroundings, or you can say noise pollutions. Okay, some sort of air pollution in some areas, like in industrial areas, some type of air pollution, as well as some type of this noise pollution may be there. That is these reasons are known as the external reasons, or you can say environmental reasons. Okay, in their family or in their workplace. Okay, these are all reasons leads to some type of the sleep disorders. That is, then another one is some medical conditions. As I mentioned, biological conditions, some medical conditions like some problem of backache problem. Okay, neck ache problem, some sort of problem related to the syndromes. Okay, and this is also leads some sleep disorders. Okay, then in some cases, Alzheimer's disease, like elderly people, age-related issues, you can say age-related issues also leads some type of sleep disorders. Okay, some panic attacks. Okay, some type of psychological reasons like schizophrenia, even in the OCD cases, psychosis cases, bipolar cases, mania cases. Okay, these acute psychological disorders also leads some sleep disorders. Okay, okay. As I mentioned, biological reasons, medical reasons, internal reasons, external reasons. Some medical reasons like heart related issues, backache problems, nervous neck problems, neck problems. Okay, and some other problems related to the acute, severe psychological issues like schizophrenia, bipolar, mania, and some sort of OCD cases. Okay, so and some cases they'll have some sort of obsessions regarding their sleep. Okay, so some people they'll think if it is oversleeping also leads some, that is their way of thinking. But some obsessions are obsessional.
Excuse me, sir. This is regarding the sleeplessness occurring during athletic training.
Sleeplessness, I can get
occurring during athletic training or sports or games training, like shoulder pain, some elbow tennis elbow. Those things occur during the athletic games and sports training. So people undergo a lot of things. Now what happens, I'm coming to the real question. The question is that all these, doctors, they prescribe the medicines, something like, pregabalin, those things, the suppress the neuro thing, they're calling drugs which are having some, effect on the nerves, numb the nerves. And as a result, long term, a lot of problem with the health issues. So the sleeplessness continues for 2 years, 3 years like that. For example, shoulder pain, because of the fat deposit under the shoulder, that gets hard and it continues for 2 years. Yeah. Now they prescribe all these drugs like pregabalin. It continues for 2 years. It numbs your nerves, numbs your brain. Okay, so what I question is that this sleeplessness will there be any real, I mean, dangerous thing like cancer, dangerous thing like brain deformity later on?
Your question is that is it really dangerous? No, that is your question. No?
Yes, yes, yes.
Sleepless. Yes, continuous sleeplessness is a dangerous condition. No?
That's right, but how long? 2 years, 3 years, like that? Because this is occurring to medical regions.
Okay, see that, but if it is 2 years or 3 years, depending on the case, depending on the issue, that is depending on all those different factors. No.
Yes. So factors are fine. Medical regions are, those things are fine, but the effect of the drugs. Prescribe the drugs like pregabalin, they some drugs which are really they have effect on numbing your brain nerves. That type of difficult lot of effect, like they prescribe the sleeping tablets, sleeping tablets, some very mild dose of that what do you call it, alprazolam they prescribe.
Definitely, this type of heavy usage of drugs or can say medicines. So it leads some sort of psychological as well as physiological disorders also. No?
Yes, because the prescription medicine, there is no psychological therapy for it, only medical therapy, only they resort to.
Okay.
That's what I'm asking. Because as a psychologist, one can have effect on the like this.
For some heavy, the problem is more better to get the combination of these both, psychological treatment as well as the medical treatment.
Okay. Because most of the athletes and the game sports personnel, they get it.
Yes, that's what I'm saying.
Sleeping disorders because of this.
Yeah.
Okay, thank you.
Okay. Then here another important topic is what is the some sort of alcohols like caffeine or some sort of I can say alcoholism or intake of alcohol and caffeine, like this type of heavy usage of these substances also leads sleeplessness, or you can say sleep disorders. Okay. Then finally,
Sir, is there any specific reason for every disorder? Or we have to identify, now this is the disorder, this is the...
Exactly.
Is there any specific reason?
Not one reason, maybe more than 1 or 2 reasons. As I mentioned, this is the way we need to discuss each and every topic. For example, as I mentioned, in our eating disorders also, some reasons we already discussed. Same way, in this sleeping disorders also, reasons, as I mentioned, internal reasons, external reasons, psychological reasons, medical reasons, and reasons related to their habits, reasons related to the severe psychological issues. These are the reasons. Your question is any specific reason? Yes, the specific reason we need to discuss along with the client. In general, we can't say all these things. Specific reasons we need to find out, then only it is easy to give the proper psychological counseling. Got it?
Okay, sir, thank you.
Yeah. Yes. Yeah, here the role of psychologist. Role of psychologist is that during this particular psychological counseling, this disorders like sleep disorders, we need to find out the actual reasons first. Okay. For example, if the reason is the internal, like as I mentioned, if it is any reason related to the depression, or you can say anxiety, or any other psychological reason, better to address that reason, better to get the solution to that particular issue, so that they will have some sort of sleep, proper sleep. Okay, if there is any reason of their anxiety, better to reduce their anxiety, and we need to find out the reason of that particular anxiety. So if you reduce that anxiety, automatically their sleep pattern may be in a normal way. Okay, same if there is any depression. See, when we discussed about the anxiety and that depression in the previous classes, the one important symptom of depression is sleeplessness. Okay, if we wanted to reduce the this type of, if we want to address the sleep disorder, first of all we need to address that particular anxiety or depression. If you solve that issue, automatically their sleep pattern will be a normal system, normal way. Okay, so various systems, various techniques we have. in order to address those issues of depression as well as the anxiety or any other emotional issues. Okay.
Sir,
so, yeah, yes.
If there is a client who is having a physiological problem, which is like damage in pineal gland resulting in loss of melatonin, and that is causing sleeplessness or sleep disorder, is there a way how to treat these clients?
See, yes, previously also I wanted to explain this thing. See, this is a psychological subject-related issues we are discussing. Okay.
Right.
In any psychological or you can say any disorder related to psychology, there may be some biological or medical reasons.
Right.
Okay. These medical reasons, with the help of the psychiatry professionals or with the help of some other professional related to the medical. So combination of these things is better to resolve it. And one more thing I want to tell here is there is a difference between the psychological aspects and the medical aspects. We are not supposed to discuss that medical aspect. Even in the psychiatric hospitals also, any mental health professional setups, okay, there is a clear-cut line between these both.
Okay.
Okay. So we are not supposed to discuss those aspects the same way. The medical professionals, they are not supposed to.
The reason I asked is one of my very close childhood friend is having that problem. Because of some drugs, his pineal gland is damaged.
Yeah, exactly.
And he wanted some help, so I thought I'll connect.
Sure. Definitely, but there's a reason.
Okay.
Sir, I was curious if sleep apnea is a medical disorder or is it a psychological disorder?
Sleep apnea is a psychological disorder. Maybe reasons may be some medical reasons, as I mentioned. Any of these 3 or 4 disorders.
Because for sleep apnea, mostly it will be like breathing, right? Respiratory restrictions. So that is a medical thing rather than a.
That's what I'm telling. So if that is all the reasons constitutes the medical reasons for all the sleeping disorders. So some sleep disorders relate to the medical conditions. Okay. Clear?
Yes, sir. Thank you, sir.
Yeah. Then.
Excuse me, sir.
Yes.
Yeah. Apart from all these disorders, sleeping disorders, the main thing nowadays going like using more type of gadgets and frequently taking medications. So these are some of the disorder which leading to sleeping.
Yeah. So these are all these reasons related to the environmental reasons. So we need to modulate their emotion, that is environmental conditions. What are the environmental conditions, the family, or you can say in the workplace? Those environmental reasons, the environmental causes lead some type of sleep disorders. Excessive use of, you can say screen time. Nowadays, even the school-going children also, they are not in a position to focus on their studies. Screen time is more. They are using even the small children also. Okay, if they want to learn some sort of rhymes, ABCD, also they are getting this type of information from the internet as well as their phones. Better to reduce this type of excessive use of screen time, or you can say any sort of gadgets.
Yes, sir.
Got it?
Yes, sir.
Yeah. Yes. Okay, shall we move for the next one? The next unit.
Okay, sir.
Okay. Then aging and psychological disorders, unit number 13. If it is possible, half of the unit we will discuss. Rest of the things we will discuss in the later stages. Okay. Yes. We have some. As you learned in your course 4 paper, there we have some developmental lifespans. One is initial stage, like infant stage, then babyhood stage, then early childhood stage, later childhood stage, then puberty, adolescent, adulthood, early adulthood, then adulthood, middle age, old age. These are the various lifespan
development.
Yeah, various developmental stages.
So just repeat the stages once again, sir. Sir?
Yeah.
So please just repeat the stages once again.
Okay. We have various stages of development. Various stages of development means these developmental stages also explained in a different way and by different psychologists, or you can say scientists. Okay. In generally there are 3 stages. In broadly, if you explain these stages of development, that is infant stage, childhood stage, adolescent stage, adulthood stage. This is one type of explanation of their lifespan developmental stages. Okay, and even Elizabeth Hurlock's developmental stages means first 2 weeks is the infancy. Second is the babyhood stage. Third is the early childhood stage. Fourth is the later childhood stage. Next is the puberty. Then early adolescent stage. Then later adolescent stage. Then early adulthood stage. Then adulthood stage. Middle age. Then old age. Got it?
Okay, sir.
Okay. So this is one type of explanation of the lifespan developmental stages. If you want to know the developmental stages related to the cognition, or you can say cognitive developmental stages. Again, there are some stages, 4 stages of cognitive development. Got it? Sensory motor stage, that is first stage of cognition. Second is the pre-operational stage. Third is the concrete operational stage. Fourth is the formal operational stage.
Sorry, sir, third and fourth?
Yeah, again I repeat. So see, developmental stages in a various perspective.
Okay.
Lifespan developmental stage means some 10 to 11 as Elizabeth Hurlock's developmental stage, overall developmental stages, as I mentioned earlier. If you want to know the developmental stages in cognitive perspective, or you can say cognitive developmental stages.
Okay.
Got it?
Okay. Sir.
Cognitive developmental stages are 4, according to Jean Piaget. Elizabeth Hurlock developmental stages are overall lifespan developmental stages by Elizabeth Hurlock's.
Elizabeth?
Hurlock, H-A-R-L-A-C-K, Hurlock. Elizabeth Hurlock, lifespan developmental stages. Right from beginning to last. Okay?
Okay. In this cognition development stage,
this is known as the cognitive developmental stages by Jean Piaget, J-E-A-N, Jean Piaget, P-I-A-G-E-T.
Okay.
Okay.
Okay, sir.
There are 4 stages. First one is the sensory motor stage. Sensory motor stage from 0 to 2 years. Then pre-operational stage. Pre-operational stage between 2 to 7 years.
Okay.
Then concrete operational stage between 7 to 11 years.
Okay.
Okay, sir.
Then formal operational stage.
Operation stage.
11 to 16 years. Formal operational stage. These are the stages. These are the developmental stages in perspective of cognition. How they cognitive. How the development of cognition. That is the reason these developmental stages are known as the cognitive developmental stages. Got it?
Got it, sir.
Then sexual developmental, psychosexual developmental stages by Sigmund Freud. Psychosexual developmental stages. Sigmund Freud's 5 stages of how their sexual, or you can say psychological development related to their sexual these things, characteristics.
Okay, sir.
Those are 5 developmental stages by Sigmund Freud.
Okay.
Initial stage is oral stage, anal stage, phallic stage.
So a bit slower. Overall stage?
Initial.
5 stages.
First one is initial, oral.
First initial stage is oral stage, O-R-A-L, oral stage. Second is anal stage, A-N-A-L, anal.
Okay.
Third is the phallic, P-H-A-L-L-I-C, phallic stage.
P-H-A-L-L-I.
Yeah, phallic stage. Okay. Then latency period, latency stage or latency period, L-A-T-E-N-C-Y, L-A-T-E-N-C-Y, latency period, or you can say stage.
Okay, sir.
Then final stage is the genital stage, genital, G-E-N-I-T-A-L, genital stage.
Okay, genital stage.
Okay. So likewise, the development is in different perspectives. And another important is Kohlberg's moral developmental stage by Kohlberg. K-O-H-A-L-B-E-R-G. Kohlberg's moral developmental stage.
This comes under what, sir?
Moral development stage.
Moral development. See, psychosexual development, psychosocial development, cognitive development, moral development. Now moral development.
No, I didn't get you. Sorry. Cognition.
M-U-R-A-L, moral development. Kohlberg, K-O-H-A-L. These are all stages are there in your fourth paper, first paper, and third paper.
Yes, sir.
These stages of development you need to learn. This will continue entire course, first and second years also. If we have thorough understanding of these stages, means, for example, if you want to learn your psychology in developmental psychology, like in your fourth course, each developmental stages, like cognitive development, normal development, moral development, psychosexual development, psychosocial development. These are the various developmental stages. You need to learn how their characteristics of particular development. For example, how the cognitive development of this particular stage, characteristics of each stage. In that way, you need to learn in your fourth paper. Got it?
Okay. Okay, sir.
One. Number two, the same developmental stages you need to learn in the third paper also, in my paper also. Why? Because how the characteristics of this particular child or the student or the person, whether these characteristics are achieved or not, that if these needs are not fulfilled, that is the reason of their psychopathological condition. That is the way you have to learn the developmental characteristics in the third paper, third course.
Okay, sir.
Got it?
Got it.
The same developmental stages you need to learn in your second year counseling psychology also, in your seventh paper, I think. In your seventh paper. How the counseling process, depending on their developmental stages, depending on the developmental characteristics. If the developmental milestones are not achieved in the particular age, that is the reason of their psychopathological condition that you need to learn in my third paper.
Okay, sir.
Got it?
Got it, sir. Now, aging and the psychological.
For example, in our previous class, like autism, as I mentioned in the previous classes, autism. Autism is their language development is not achieved. Means motor development or the language development, you can say communication development is not, their developmental process not achieved in the particular age. That is the reason of the particular psychological issue. Not mingling with other children in the group. Got it?
Okay, okay, sir.
If their communication is normal, they will mingle with other children in the group. Not mingling with other children in the group means skill deficiency. communication skills deficient. That is the reason these children they are not mingling with other children in the group.
Okay.
Got it? So why this psychopathological condition is, this is the reason. Their developmental milestones are not achieved in the particular age of second year or third year. That is the reason this child is not mingling with other children in the group. Lack of communication. Their skills are not achieved. Their developmental milestones are not achieved in the particular age. This is the way we need to understand developmental characteristics in this psychopathology.
Okay, sir, got it.
Got it?
Got it, sir.
So means nothing but psychopathology, entire psychopathology talks about the deficiencies of particular age only, no?
Deficiency of the age, and
Okay.
see, as I mentioned, even today also I mentioned, in each and every psychological disorders, we need to find out the reasons.
First.
Maybe that might be one of the reasons, no? Not achieved, as I mentioned yesterday, just today only I mentioned. We have some needs fulfillment as a human being, as Abraham Maslow's hierarchy of needs. First need is what is the first need?
That is food and the first need is food and sleep.
This is Abraham Maslow's pyramidal shape. Abraham Maslow's. You know that, it's already, I think it is completed your syllabus. Abraham Maslow. Yeah.
Excretion, sex.
Exactly. So these are the basic needs. Yes, Abraham Maslow's hierarchy of needs. These basic needs are not fulfilled. What happens? Basic needs means sleep and eating. Okay, sleep and food. If these needs are not fulfilled, what happens? Some sort of
disorders are
psychological disorders. So this might be one of the reasons. Same way, in any psychopathological condition or in any psychological disorders, having some sort of reasons. Not
find out the reasons.
Fulfillment of that particular developmental task in that age. That also leads some psychological disorders. That disorder may be autism, that may be ADHD, that may be sleep disorders, that may be the eating disorders.
Okay, got it, sir. It's very clear.
So my sincere advice to all his students, see, better to learn these developmental theories, or you can say developmental this type of stages. As I mentioned, like normal developmental stages, or you can say lifespan developmental stages by Elizabeth Charles. You need to learn each and every development, what are the various domains of that particular development. Like, for example, the initial stage, motor development, language development, physical development, psychological development, social development, moral development, sexual development, then cognitive development. Each and every stage. If you have thorough understanding of these developmental milestones, it is easy to organize your answers. The same developmental milestones, the developmental characteristics, you can write in your fourth paper. The same application part of developmental milestones in the third paper. The same developmental milestones are developmental characteristics of this developmental in other courses in your second year also. For example, counseling psychology one course is there, one subject is in your second year. There also these type of developmental characteristics you need to understand, and you need to apply these developmental characteristics, whether they are achieved in this particular age or not. Depending on that, we need to give the counseling, or you can say psychological counseling to any sort of issue. Okay, yes. Here in this age, as I mentioned, in the aging, there are some mental health issues you find in the old age. Okay, why this mental health issues? The same problem again. Because as I mentioned, in the old age, there may be some physiological issues. If these physiological issues continuously, they will have these physiological issues of like sight, or you can say some sort of medical issues. What happens? These type of physical problems leads some psychological reasons. Got it? So what are the general health issues in the old age people?
Sleeplessness one is sleeplessness at nights. They are awake in.
Okay, that is sleeplessness is one important disorder. Now I am talking about the other medical issues. In this
Hypertension, sugar.
Memory loss also.
Health
Memory
problems
loss.
they have.
Yeah, diabetic.
Diabetes, BP,
Dementia.
Memory issues.
Yeah, like
sight problems.
Physiological, like means the problem may be some sort of sight. Okay.
Repeating the same thing again and again.
Exactly. So memory issues.
Bone-related issues, sir.
Exactly, bone-related issues. So these are the some sort of medical issues, some sort of physical issues they'll face. Any individual in the stage of 60 above or 65 above, they'll face in the old age this type of issues they'll face. Okay, due to these issues of medical conditions, it leads to some type of psychological conditions. This type of issues also known as the psychosomatic reasons. Okay. Yeah. So here in this age-related issues, one is delirium. Second is the dementia. This dementia also known as the Alzheimer's dementia. Okay, Alzheimer's dementia is the another important issue related to the elderly people, or we can say old age people. Then depression, elderly depression. Okay. Then insomnia, sleep disorders in the elderly people. Got it? One is delirium. Delirium also one important psychological problem in this old age people. Okay. So here in this.
Sir, and also some memory loss also will be there, no, sir?
That is dementia, memory loss, dementia. Dementia also there are non-organic dementia and organic dementia. Non-organic dementia means without any medical reason, that is known as the non-organic dementia. Okay, without any medical reasons because of their psychological reasons, that is dementia. And organic reasons means due to their medical condition. Some non-organic means without any structuralism, problem of their structure, problem of their bodily issues. That is non-organic. Organic means with their problem, with their medical reasons. Okay, so here maybe dementia may be both organic, non-organic dementia. And this dementia also known as the Alzheimer's dementia. Why this Alzheimer's? The name of the scientist is Alzheimer's dementia. Okay, so here delirium is also one important problem in the old age people. Okay, here delirium means one important. I think 3 o'clock. No, shall we continue in the next class?
Yes, sir. It's already 3 o'clock. Other teacher may also wait.
Okay. So just to finish this delirium only, sir. So just to finish the delirium, sir.
Okay. So here it is delirium. This is one type of issue in this particular age, that is old age. Okay. In this old age people, generally, they won't focus on a particular issue because of their concentration problem, because of their medical related issues. Okay. Or maybe some other reasons related to their physical aspects. So the problem is that their concentration, their cognition, maybe you can say their cognition may be some sort of deterioration. Cognition means their thought process. There is no coordination of their activities, their thought process, and their behavior. Okay, no coordination of these three. Got it? one important reason of this is age. Another important thing I want to explain is you can't say it's a generalized issue. It depends on the case to case. Okay, and one more thing I want to explain here is, so now it's the old age, or you can say old age, or you can say aging. It's also related to that is thought process. Got it?
Okay.
Any doubt here in this?
Sir, you said three things, no, sir? There is no coordination between thought process, action, and what is the third one, sir?
Behavior.
Okay, sir. Thank you.
Okay. So here, their cognition, or you can say perception. Okay. Then their behavior. Whatever they perceive, maybe some perception may be not up to the mark because of their age. Got it? So here, if they are not having proper coordination of these three: perception, cognition, and the behavior. What happens? Some sort of confusion. Got it? I can say mental confusion.
Yes, sir. Yes, sir.
Whatever we perceive, okay, we need to understand, we need to analyze, we need to interpret that one. But because of this poor memory, or you can say, some sort of iterated cognition, whatever they perceive, they won't be in a position to analyze it in a proper way, interpret it in a proper way. What happens if these two are not happen? If these both coordination is not proper, what happens? Automatically, it adversely affects on their behavior. Got it? For example, whatever they're perceiving from their family members, their perception is in a different negative way. What happens? They think in a different way, in the negative way. Automatically, the behavior also in a different way. That means some sort of mental confusion due to not coordinating of these three: perception, cognition, and behavior. So this type of extreme mental confusion months together or for a long period of time leads this type of delirium. Delirium also, one other important reason of this delirium is some sort of, as I mentioned, medical conditions, medical reasons.
So delirium will be not an optimistic way. They will be thinking in a negative way only.
Whether it is optimistic or pessimistic, their coordination, as I mentioned, the perception, cognition, is lack of these three coordination may not be there in these three aspects. Okay. Optimistic means it's a positive way. If these things are in a positive way, automatically they think in a positive way. So whether it is positive or negative, I am talking about some type of mental confusion, severe mental confusion. You can observe this type of mental confusion in this age
Delirium patients.
people if they have delirium.
Okay.
That is one important reason. Second is some medical reasons also, medical conditions also.
Okay. Okay.
Okay.
Okay, sir.
Because of their some other medical issues. Okay. One important thing is age-related issues. Second is no coordination between these three. As I mentioned, that is perception, cognition,
behavior,
and behavior, and some type of severe mental confusion. See, it's already 5 to 6 times. They are giving.
Okay. Thank you, sir. Thank you very much.
Yeah, thank you.
Sir, excuse me, sir. Sir, briefly say, sir, amnesia, types of amnesia. Briefly say about types of amnesia.
Actually, sir has left the Zoom meeting. You can check though.
Another session will start out.
Yeah.